Recording in
Hello and welcome. I think we'll give about 1 minute for participants to join in, and then we'll kick off this webinar. Dear participants, welcome to the ShowCase webinar of the International Confederation of Midwives, where you will have an opportunity to learn about the work of ICM and the impact that midwives can have, especially during crisis, and the importance of promoting midwifery leadership. My name is Igel, and I'm the Grants Management Lead at ICM, and I'm excited to introduce our wonderful speakers today. Before that, I would like to ask all of you to introduce yourself using the chat function. During the webinar, if you have any questions, please use the question and answer box, which we will monitor. Today, we're joined by Dr. Sally Perriman, the Chief Executive of ICM and a midwife from New Zealand with more than 35 years of experience in all aspects of midwifery, including practice, education, and regulation. Prior to joining ICM, Sally served as a president of the New Zealand College of Midwives. Sally will be introducing the work of ICM today and highlighting achievements and lessons learned. Next, we will be joined by Professor Jacqueline Dunkley-Bent, the first chief midwife of ICM, who previously served as the first chief midwifery officer for the National Health Service in England. Jacqueline is a registered nurse and a midwife and a visiting professor of midwifery at King's College London and London South Bank University. During her presentation, Jacqueline will focus on midwives in leadership. To continue, we're excited to have Ashu Martha Abganyenti, a midwife and a graduate of ICM's Young Midwife Leaders program, to talk about her experience as a YML and why we need midwife leaders. Ashu recently received a 2023 Global Goalkeepers Changemaker Award that was awarded by the Bill and Melinda Gates Foundation. Given the current global context, we will be joined by Lieselotte Kwiegel, a midwife from the Netherlands, medical anthropologist, and a midwife advisor at ICM, who focuses on strengthening midwife associations. During her presentation, Lieselotte will talk about the vital role that midwives play during a humanitarian crisis, drawing in examples from Ukraine. And next, we will explore the impact of climate change on maternal and newborn health and the role the midwives play in mitigating these challenges through a presentation by Neha Mankani, a global health practitioner and a midwife from Pakistan, who was recently awarded a Women of Courage Award for her emergency response midwifery work in Pakistan. Also, just a few weeks ago, Neha was chosen by BBC's 100 Women list in the category Climate Pioneers for her climate catastrophe relief efforts. Neha works on strengthening the capacity of ICM member association. And with that, I would like to welcome Sally and give the floor to Sally to start her presentation. Thank you.
Thank you, Igel. I'm going to talk briefly to you all, and thank you all very much for joining us, about the last year, or this last year of 2023, what we've achieved and what lessons we've learned along the way. Next slide, please. So for those of you who don't know the International Confederation of Midwives, or ICM, we are a global midwives association, and our membership is approximately 140 midwives associations based in around 120 countries around the globe. And we have various roles there. We set global standards, we work in advocacy at global, national, regional and national level. We provide member services, we work with partners. We're very much about really trying to bring attention to the essential role that midwives play in providing quality care for mothers and babies during the childbirth process, preventing, preventable maternal mortality and morbidity, and the same for babies. And we work as experts. We are experts. We advise, we influence, we create, and we enable the profession of midwifery globally. Next slide, please. So our last triennial strategy, which is coming to an end this year, so we've been running this for 3 years, we've had 3 strategic priorities. One around innovation and sustainability of the ICM as a whole. One about rolling out our professional framework for midwifery, and one about fostering a movement for midwifery, advocacy, bringing attention to the role of midwives and what they can do. And under each of these strategic priorities, we've had a number of activities. And the 4 kind of categories, I guess, of work that we've been doing, you can see there a lot of work on sustaining ICM, building up our organisation, the infrastructure for ICM, building our own capacity, working with our members to build their capacity and help them take their place as the voice for midwives in their country, recognised by their ministers of health and other decision makers as being at the table, or needing to be at the table when anything to do with maternal and newborn health is under discussion. Working with the activities to raise attention to the profession and all of the elements of the profession that need to be in place to have a strong midwifery workforce in any country, and lots of work on advocacy. We also have been working in country on various different projects, and we will mention a couple of those in this presentation. There's a number of different groups and individuals that we work with, and obviously our ICM board, all of our members, all of our partners, many of you, our donors, and the broader ICM staff that is based not just in The Hague, but actually around the world. Next slide, please. As we move into our next triennial strategy, we will be having 4 strategic priorities. So the ICM Council, which is made up of all representatives from all of our member associations, have indicated to us that we are to continue with the strategy that we've been on, because obviously there's still plenty of work to do, but that we're also to add a focus on climate and humanitarian crises. So there will be some small modifications, but you can see here the strategic priorities that are going to be in the next triennial strategy, which will hopefully be signed off by our board before the end of the year, and we will commence working on it next year. So taking us to 2023. There's been many achievements, and we've just put the main ones here. You're going to meet Jacqueline Dunkley-Bent, our first chief midwife, who we appointed just before the Congress, and we're very pleased to have a chief midwife at ICM, because we want to role model what we are asking other organisations to do, and especially asking governments and ministries of health to do. We had a very successful triennial congress this year in Bali. Some of you were there, and that was the first time that midwives globally had been able to get together since the pandemic, and it was a very, very successful congress. We have a new board that was elected and took over in June of this year at that same congress. And for the first time, they were appointed through an independent election committee process. So we know that we have a board that is already assessed as being competent in terms of governance and are already providing strong leadership for us. We've also reduced the number of board members and built up the head office support to each of our regions and to our board. We've been working on lots of midwifery education resources and a number of resources under our education development pathway that are for midwifery schools in particular, midwife educators. And we have an accreditation program that can be utilised to assess whether or not a midwifery education program is working to the ICM standards. We've increased the number of partners that we're working with, and we have increased the core funding that we are receiving. We are the implementing partner for UNFPA in Bangladesh and working really closely with our association there, the Bangladesh Midwives Society. Some of you will know of the work of the STAGE and WHO, and I have the pleasure of co-chairing the Midwifery Working Group, and we're very excited that STAGE is really emphasising midwives and midwife-led continuity of care, and going to be recommending this to member states as the way forward in terms of strengthening their maternal and newborn health services. We have our last group of young midwife leaders just completed, and they have been amazing, and you're going to hear from Usha Martha shortly. We're running a Twin to Win program again with 6 midwives associations working in pairs, supporting each other. And this is south to south twinning. This is not about north-south. So a really different model to what has happened in the past. You're going to be hearing about the humanitarian support that we're providing in various countries. We've also been very pleased with the Midwifery Services Framework initiative that's happened in Zambia, which has been a long piece of work. It's still ongoing, but we're delighted that the Zambia government has included midwives in its health plan and is working to strengthen the profession and to establish midwife-led units in Zambia. We've completed our midwife-led birthing centre research, which gives us a lot of insight into midwife-led centres in low and middle-income countries. And from that, we've been able to develop a readiness tool for potential new units, and that's been used in Zambia to look at the facilities they have and whether they are ready to transition into midwife-led units. We've strengthened our regional approach. We've identified deep engagement countries. We've continued working on our push campaign, and we are continuing to roll out our Gender, Jedi and Sustainability Plan. So those are just some of the achievements. Next slide, please. From this, we really try to take a very much a learning approach to our work. And there's a number of kind of challenges that we've had and lessons that we wanted to talk about. So we really understand the need to be working locally, and we can see, in our example with Zambia, the importance of that very close relationship with local partners and stakeholders if we're going to really make sustainable changes. They need to own it. It can't be top down. It has to come bottom up, and it has to be owned locally. Of course, we need to be able to adapt all of the time. There's so many challenges that just come at us, and we have to be flexible and respond, and that's not going to go away for any of us with the climate issues and humanitarian issues that we are facing. We know that midwives are not able to succeed unless they're working in an environment that really supports them to succeed. And there's a number of elements in the enabling environment that we have identified through our policy brief on the enabling environment, and to which we continue to really try to bring attention, because it's much, much more than just educating midwives. They have to be deployed. They have to be able to work effectively, have the appropriate resources and environment that they need. And of course, they need to be respected and properly remunerated. So there's many things involved, and it's quite complex, but it can be done to set up a really solid midwife workforce. We think that really understanding how our health system works at a country level is important. If we're going to make changes, we need to identify what barriers are there, who is holding the power, what the policy making cycle might be, how to partner, who to partner with. And we've learned those lessons from our work in Zambia, and where we'll be taking that forward. We've also really tried to maximise synergies across our projects and across our donors. And I've mentioned already the linkage between the work we did on midwife-led birthing centre research and then the tools that we were able to develop that are being piloted now in Zambia. We need to continue to strengthen us as an organisation and all of our member associations, because and that's continuing a challenge, of course, because we're trying to do a lot of things at once, but we all need a really solid base in order to be able to do our work. We know that policy and financing wins take time. They're not just quick things. It takes years and a lot of work and a lot of energy by many, many people that we need to partner with. But we've learned a lot of lessons around that as well. We know how essential core funding is to us. It's totally enabling, because it gives us a lot more freedom to really focus on the things that we need to be doing. And we recognise the need for that core funding to also happen for our midwives associations. And as you're going to hear, midwives are really positioned, because they're part of communities, and they're in primary health, and they are able to act. They're already in countries when crises happen, and they are able to be supported to make a very positive difference, not just in maternal newborn health, but also with climate and humanitarian crises, as you will hear. Next slide. So I want to talk just very briefly about the importance of investing in midwives. I think this won't be new to you. So just quickly, the next slide, please. Next, yeah. Oh, okay. Did we miss 2 slides? No? Okay. I want to just take you through the scope of practice of a midwife. And I'm sorry that this is a little bit dense, and we will share these slides. But it's important to understand that midwives on their own responsibility can provide care to women and babies through pregnancy, labour and birth, and the postnatal period. For the majority of women, when they're healthy, they will have an uncomplicated birth, especially if we don't intervene with that and we don't apply unnecessary interventions. But there are a group of women and babies that will need specialist input, and midwives need to be able to consult and refer to obstetricians and paediatricians, neonatologists as necessary. The kind of care that midwives can provide is accessible, available, acceptable, affordable, and quality care. It's in primary, secondary, and tertiary. Midwives can provide all of the BMONC functions themselves. And of course, we understand there's a huge amount of data to support midwife-led continuity of care models. I've mentioned already the importance of the enabling environment to that, a midwife's ability to provide care. And midwives bring a particular approach to care that's very distinct from other health professions. It's respectful, holistic, anticipatory, individualized, it's personalized. It's about building a relationship with each woman and helping that woman, making sure that that woman's needs are met. And midwives as a group need to be educated and competent, regulated, and working within professional frameworks that support these things. And of course, there's also integration with other services, as I've mentioned there, abortion care, broader sexual and reproductive health, and childcare, and so on. Just very quickly on the next two slides, I'm just going to flash them in front of you because I'm over time now. But we know, you know, this data about what midwives can do and the lives that we can save if we actually do have a supported midwifery workforce in every country, working to the full scope of practice. And the next one. And the continuity of care model has huge ability to improve outcomes for both mothers and babies, as well as satisfaction for women and families. And next slide. Finally, the framework for midwifery. This is ICM's framework. We have identified 10 essential elements for a midwifery profession that need to be in place for a midwifery profession to be strong in every country. We use this as an organising framework for all of our work. Jacqueline's going to speak to you now about leadership, and she will pull out the leadership piece. But you can see that at the centre we've got the philosophy and the competencies, and then we've got the various other elements that are essential to a profession around the outside. Thank you very much, and over to you now, Jacqueline.
Thank you, Sally, and I'm delighted to have this opportunity to share our vision of leadership with you today. The midwifery profession, of course, it relies on strong leadership at every level, from an individual midwife's perspective to midwives associations and beyond. We know that midwives are also needed in formal leadership roles. I'm thinking about ministries, chief midwives, health systems and beyond. And this is why the ICM, one of the reasons why the ICM is currently advocating to ministries of health for the establishment of chief midwives to lead midwifery at a national level, in country and ministry. So I'm going to speak to you for the next few minutes about where we sit in relation to leadership. What are the policy drivers saying about midwives being leaders? And indeed, how this is underpinned and influencing our professional midwifery, our framework, our professional framework for midwifery. And then I'm going to mention, what are we doing now? And I'm really excited to share with you in a short while our leadership plans, or at least our thoughts around our leadership plans. So what you can see on the screen here are some key points, some quotes, some statements taken from some key documents. Leadership is integral to and interrelated. It's an interrelated component of the ICM's professional framework for midwifery. That's the diagram that you see on the right of your screen. And I'm going to share a little bit more about that shortly. But just of note, the statements to the left of your screen are taken from documents like the State of the World's Midwifery Report, the Global Strategic Strategy for Midwives and Nurses, the Every Newborn Action Plan, the document that refers to ending preventable maternal mortality, WHO published guidance, evidence-based guidance, literature, and so much more. So we can see that there is an understanding that there needs to be strong leadership within the midwifery profession, and we really need to get behind our midwives as leaders. What is of concern if we look to the fifth bullet point from the top, the unwarranted variation in the number of countries with midwives in leadership positions. And it's really important to us at ICM to really level up and ensure that we have consistency in terms of that opportunity to serve women and families well. And indeed, the State of the World's Midwifery Report refers to 9% of countries that do not have leaders that are midwives. And the remainder, of course, have variation in where midwife leaders sit. So as I reflect, I'm now 6 months in to this amazing role, as I reflect on the data that shows that 810 women will die in childbirth every single day. These are global estimations. One stillbirth every 16 seconds. We know that midwives as leaders in the right place with the right infrastructure can make a significant difference. This is why I'm going to move now to the professional framework for midwifery. This is why the ICM's professional framework for midwifery is so significant, because it acts as an informative and guiding tool for the ICM, its members, partners, and stakeholders. And you can see for yourselves there that there are 10 elements, 10 significant elements of this framework. And when I joined the ICM, I was really taken with the detail behind each of these elements and how they are interrelated and interwoven. So one is interdependent on the other. If one is destabilized, then the other is. So we have the philosophy that explains midwifery care and promotes and protects women's, the ethos of how women are cared for, reproductive and sexual health. We have the essential competencies for midwifery practice that are interconnected with each of the elements of the framework. They reflect the midwifery philosophy, and of course, they form a bedrock for midwifery education. Education, of course, midwifery has its own education system, and of course, the ICM sets global standards. But the regulation, of course, that relates to protecting the public, these are all interrelated. And the regulation element of this model provides a regulatory function, and it includes the scope of midwifery practice. Associations that we're all familiar with, associations play a vital role in connecting and supporting midwives by enabling them to come together with a collective voice, advocating in country. Research, all our work should be underpinned by research, and that's why research is such a significant part of the model of this framework. We have, of course, a commitment for diversity and equality. But I want to move on to a really significant part of what's next. What's next for leadership? I'm currently developing a leadership plan that aims to guide, support, and influence our midwives associations to nurture current leaders, develop future leaders, and develop a career structure that works within the context of the country's health needs. A plan that includes a pragmatic how-to guide that recommends all countries work toward establishing midwifery leaders at a political, operational, regulatory, education, research, and in all clinical settings. The cornerstone of this plan is, of course, the ICM professional framework. Not only do the 10 core elements of the framework inform sustainable development of midwives, but there is a strong focus on midwives as leaders. A plan that describes a leadership structure, a career structure, and how this can be applied in country, because one size does not fit all. A plan that's ambitious in its design to proactively support a long-term commitment to develop leadership skills as part of each midwife's competencies and prepare midwives for formal leadership positions. I'm really excited to have joined the ICM at this time and consider It's an absolute privilege to use my experience to build this plan. However, if we're truly serious about moving the dial on maternal mortality, perinatal mortality that includes stillbirth and neonatal death, further investment is needed for this plan to become an absolute reality. We can go further faster with further funding. We owe childbearing women and babies, and indeed the midwifery profession, that much. Further investment in our leadership plan has the absolute potential to assist with implementation of the plan in some of our deep engagement countries, namely Bangladesh, Burundi, India, Kenya, Malawi, Pakistan, Zambia. And these countries, of course, are chosen because of the burden of the high mortality rate and because they're target countries for the WHO's Ending Preventable Maternal Mortality Initiative. So finally, investment can assist with moving further faster with leadership training, coaching, mentoring in country, and of course, ensuring that this is sustained. However, the USP, the unique selling point for this plan, I'm hoping will be our leadership plants. And this concept is in discussion at the moment, but a leadership plant we envisage will be leaders that are grown in country, supported by ICM, myself and others, that will really walk alongside our midwives associations, our midwife leaders, to have that seat at the table in ministry, to be able to speak truth to power in a credible way that's heard and understood, so that we can finally move the dial on preventable maternal and perinatal mortality. We have the formula to effect sustained change. We need investment to do this well. Thank you.
Thank you very much, Jacqueline. Now over to Ashu Martha.
Thank you so much, Ego. And thank you once again, Dr. Sally and Dr. Jacqueline, for such insightful and very detailed session. So I'm going to be sharing from a very personal and, youthful oriented perspective. So just so we are clear, these are photos. Both photos are photos of me. The photo on the left is a picture taken, I think, 4 years ago, 4 to 5 years ago. And that on the right is a picture that was taken in September of 2023. So before I became a young midwife leader with ICM, I was just a young girl who just started her midwifery courses, and she was very passionate about seeing and ensuring that young midwife, my fellow classmates who were equally students, are very, very intentional about the profession. I didn't know exactly what I was doing, but I was sure that I was heading somewhere. And eventually, when I was selected for the Young Midwife Leaders Program in January of 2022, it became a thing of joy because I was able to carry out projects, small scale projects back then when I was just a young student midwife. But then when I got enrolled into the program, I was able to carry out projects on a big scale. And that takes me to this very deep words I want to say, and that is being a young midwife leader was about carrying the hopes and dreams of countless midwives on my shoulders, and particularly the young midwives, because young midwives are the key to sustainable maternal and child health. Young midwives are a treasure that have to be secured. And of course, these are words I shared on the global stage when I received the Goalkeepers Award, which of course is the photo on the right, back in New York. And of course, the Young Midwife Leaders Program was a whirlwind of empowerment, of knowledge and connection. I learned from incredible mentors, our coordinators. I was able to rub shoulders and share ideas with other young midwife leaders from across the country. And this program not only opened me up to the global midwifery world, it equally catapulted my midwifery career personally, and enabled me to be able to show to other young midwives back in my country that there is more to this profession than what we see. I remember starting my midwifery career and not knowing about ICM. And it was one day when I sat and I just held my phone and I saw a post pop up from I think it was a sponsored post. And then I went on to share it with my class. I was like, do you guys know that there is an ICM that exists? There is a whole confederation of midwives that exists. So please go on and follow the page. And I was able to influence everyone to follow the page. And from that time on, the news kept spreading and spreading. And today, so many Cameroonian midwives are very much aware of the fact that there is ICM and there is a confederation we can run to when there is anything we have to present. And equally, there is a huge need for midwife leaders, and particularly the young midwife leaders, because my country was currently facing a crisis with respect to young midwives staying in the profession. Many of them felt discouraged because they didn't quite see a clear pathway that was already set for them. So, as youths, we always have the tendency of wanting things very fast. We want to be sure of what we are seeing and where we are headed. And once there is this doubt somewhere, many of us tend to draw back. And so students, young midwives constantly need that aspect of reassurance, which of course can only be given through orientation, proper orientation programs and seminars. And this was my Young Midwife Leaders program. It actually still is because I'm currently still working on it. So many student midwives, 180 student midwives in particular, were able to be orientated to stay in the profession. And now, because there's currently a follow-up going on, those student midwives are still very much interested in staying in the profession and ensuring that many more other student midwives who are coming behind them are intentional about saving the lives of mothers and babies. So we have to invest in midwives, just as Dr. Salipeman mentioned. We have to keep ensuring that young midwives have all they need to be to feel protected, to feel like there is much more for them in this profession. And speaking on behalf of many young midwives around the world, and not just myself, we are hopeful that the future is bright and that we are going to keep being given the space we need in order to be able to explore our full potentials. And this can only be done when a lot of efforts are put to ensure that young midwives are on the pathway, they are on the map. So thank you so much. Over to you, Ego.
Thank you so much for Asha Martha for providing that beautiful overview of your experience. Now we will move on to our last section, which will be presented by Lisa Lotte and Neha. So first, over to you, Lisa Lotte.
Thank you very much, Eigel. And hi, everyone. In this short presentation, I will talk about the role of midwives in humanitarian crises. And I will give an example from Ukraine to show how midwives provide continuous support to women in humanitarian crises. Next slide, please. So as we all know, the world is dealing with an increased number of humanitarian crises, and the crises are becoming longer, more severe, and more complex. And especially in those crises, women and girls are vulnerable to sexual and gender-based violence, and often they have little or even no access to sexual and reproductive health care. And this is why midwives and also midwives associations advocate globally for better healthcare services for women and girls in humanitarian settings. Next slide, please. So there are a couple of reasons why the role of midwives is important in humanitarian crises. And the first one is that compared to other healthcare professionals, midwives are the only professionals that are equipped to provide continuity of care to women and their newborns during pregnancy and birth. They can provide more than 90% of sexual and reproductive health care, and they work collaboratively with other professionals like obstetricians, neonatologists, pediatricians. Most often, midwives work in the communities, and first response when there's a humanitarian crisis happens on the community level, which is why midwives are uniquely positioned to reach crisis-affected areas and help women in the communities and provide care. And because they work in and with communities, they also have a deep understanding, a deep contextual understanding of community behaviors, and also intimately understand the experiences of women and children in the community. So they know what actions are needed to make a difference. And lastly, I mentioned that midwives are first responders during crisis, but they also stay on for the long term. Because they're usually part of the community themselves. So that is why they can provide emergency response, but they can also contribute to emergency risk reduction and emergency preparedness in a community. Next slide. I have a case study from Ukraine that shows how midwives provide continuous care to women and their newborn. The war in Ukraine, as you know, started in February 2022, and it impacted and still impacts many women and children. And it are midwives and midwives associations that are at the front lines of this crisis, of this war. For example, when the war started, midwives did not put down their work. They kept coming to their maternity hospitals, sometimes even taking their children because they wanted to be able to stay together. And also, midwives intensely communicated with each other, and they formed a strong network alongside evacuation routes, especially in the first days and weeks after Russian invasion. Midwives would, for example, call their colleagues further along this evacuation route to make sure that their pregnant women would receive care wherever they would make a stop when they were evacuating. And lastly, midwives set up a channel through Telegram, and they support pregnant women that have no access to medical care. They even support women giving birth through video calls. And that service is still running up until today, 24/7. Women that don't have access to care can call a midwife through this channel. So I'd like to share the story from Vera. Vera is a midwife from a city called Chernihiv. That city borders with Russia and Belarus. Vera shared her very powerful story with 2,000 midwives during our ICM Triennial Congress in Bali in June 2023. And she said that it was okay if I would share a part of her story with you as well. And I'm going to read this out. She said, "We got involved in Russia's full-scale invasion from the very beginning, the 24th of February 2022. It was supposed to be my routine shift, which eventually lasted 42 days. There was no time to prepare for anything. I called my husband and told him to move out with our daughter and my old mother of the city to the countryside, hoping it would be safer for them there, because there was no way for me to leave my pregnant women. But I was so wrong. Just in a couple of hours, my family got under occupation and I lost contact with them. There was no internet or mobile connection. Soon the whole city was surrounded. All bridges were blown up. All kinds of bullets hit our perinatal center." Next slide. "We decided to leave it and went down to the bomb shelter. We thought all would end in a couple of hours, but we had to stay there for more than a month. Our bomb shelter wasn't prepared enough for such an amount of people, especially with special needs." Next slide. "We had to use boxes, planks, different building materials, even old doors along with stretchers to accommodate pregnant women and women with their newborns. Winters in our country are cold. It was around -12 degrees Celsius during that time. There was no electricity, heating, water supply, or sanitation. We had to work in incredibly hard conditions, and it was very painful for me personally not to know anything about my family for such a long time. But I couldn't show my worries or weaknesses because of all of those eyes that were looking at me with hope. I wanted to help them, not only as a medical worker, but also as a woman, as a mother. We had to fight our fear because we were responsible for women's lives, or to be more correct, for 2 lives, the woman and her newborn child. Along with all, under terrible bombings, we had new lives, and we hadn't lost a single life during that time, neither mothers nor babies. When the child was born, his or her first scream was so powerful that it seemed for all of us to be louder than all those shootings. It gave us strength to keep on working. In such conditions and despite all circumstances, tiny but already strong in spirit, Ukrainians were born. From the 24th of February to the 6th of April, we had 146 newborns. There are 3 twins and 2 triplets among them. So I believe this story is extremely powerful, as it shows the dedication and the tireless efforts that midwives make to support women in humanitarian crises and during this war in Ukraine. With support from Direct Relief, midwives associations in surrounding countries also implemented projects to support refugees from Ukraine. For example, the associations in Hungary and Estonia distributed sanitary products and equipment to refugee camps. And the association in Romania even managed to provide free care to women and girls from Ukraine. They set up a call center where they received more than 1,300 calls, and they provided sexual and reproductive health education to 108 women. So in Ukraine, ICM, we are currently supporting midwives to establish their own midwives association, to strengthen that association, and they are in the process of becoming an ICM member. We connect them to stakeholders in country, and they are using our core documents and tools to make a case for a midwife-led model of care in Ukraine. Next slide, please. So what is ICM's role? So as Sally already told you, ICM represents 139 midwives associations in 118 countries. And I think we have a unique position because we've built a long-standing and trusting relationship with the representatives of these midwives associations. With many of them, we've worked on projects for a long time and we know them well. Sometimes it is challenging for international humanitarian aid to get into the country, like for example, in the case of Morocco in September when the earthquake struck. But we as ICM, we were able to quickly reach our midwives association in Morocco, and they were able to provide support to the affected communities on the ground. Midwives associations themselves have a large network of midwives, and they can ensure that the infrastructure is in place that is needed for community to access care. Also, they are an effective network through which information, supplies and medications can be distributed. Like for example, in Turkey, where the Midwives Association used their network to distribute kits to earthquake affected areas in February this year. It's ICM core work to strengthen midwives associations, but associations have different needs, of course. We tailor our support to their needs, and we also find it important to provide long-term support. So for example, in Ukraine, with the support from Direct Relief, we provide a train-the-trainer program to improve the resilience of the midwives associations and ensure their emergency preparedness. And finally, ICM facilitates a platform where midwives associations and midwives can share their knowledge and experience on humanitarian preparedness and response. So in conclusion, the role of midwives associations, we believe, is underrepresented in crisis preparedness and response at a national and international level. But if you look at the midwife-led model of care, that relies on less physical infrastructure because midwives go to the communities themselves, and also fewer resources, it is actually uniquely positioned to still deliver care in times of crisis. So we will continue to stand with Midwives Association and advocate for midwives and midwives associations to have a seat at the table where the decisions are made. Thank you very much.
Thank you, Liselotte. And now I'm happy to pass the floor to Neha. Over to you, Neha.
Thank you, Aigul. I think we're really well positioned in the middle of COP right now to be having this conversation about the role of midwives in climate change and climate emergencies. So as introduced, I'm a midwife from Pakistan, and I've been working on climate for a while. Climate has become front and center of my work because unfortunately, Pakistan is generally a very heavily climate affected area because of how we're set geographically within mountains. We have a sea, glaciers, lakes, which means we see flooding, intense heat, drought, earthquakes, cyclones, sea storms. And sometimes we see all of them come together to create this perfect storm, like what happened last year. So in my work, I see two aspects of climate issues. One is climate affected communities, and then the second is climate disasters. And the center of all of this is the effect of climate on maternal and neonatal health, and the very central role of midwives, both as first responders and mitigators. Slide, please. Next. So I'll talk a bit about my role in both the recent climate disasters I've worked in, which also expands on the role of midwives in humanitarian context that Lisa Lotta shared earlier. So I'll start with the floods of 2022. Here is a photo of a hospital in the province of Sindh in Pakistan. This was a facility where we had set up a midwife-led birthing center. And this is what the center looked like after the floods last year. So the one on the left is what it looked like before. So this was just one of the 2,000 health facilities that were damaged in the floods. These floods were really catastrophic. The estimate said that there were around 33 million people who were affected. Next slide, please. So I was involved in the emergency response to these floods, and we had a team of 2 midwives, and we started by wanting to provide clean birth kits to women who were displaced. But soon we realized that the need in a crisis of this nature is just so much greater than that. So there were almost no health services available for women on the ground. And this was coupled with the fact that they had lost their homes. So there was a need for birthing services. They needed prenatal care, newborn feeding challenges. There were postnatal checkups, birth spacing, abortion care, reproductive health infections. We needed to do referrals. There was sexual violence, and adding to that, infectious diseases, which are obviously very common in climate disasters. So there was a whole spectrum of needs that women experience in displacement. And as midwives, we could meet a lot of those needs. But the other thing that it really helped us think about was the flip side of this, that what could have happened if there was a pool of well-resourced, supported, and trained community midwives in these communities, and how the disaster that unfolded for women actually could have ended up being quite different. Next. The second climate disaster that I wanted to share was a community I work in, which is in a state of ongoing climate crisis. So this is a coastal island community. It's a set of fishing village islands that I provide care in, which is heavily climate affected and it's also extremely affected by environmental degradation. So here we see every day the effects of climate change on maternal and newborn health. So we are seeing in our practice, we're seeing adverse birth outcomes related to extreme heat. We see constant outbreaks of disease due to the environment. We've seen a fall in nutritional status because of the loss of livelihood. And with that, obviously, comes a lot of mental health challenges, gender-based violence, and this can all be attributed to changing climate patterns and the impact. And we also see a constant need for emergency preparedness and planning with rising sea levels and increasing climate emergencies in these areas with threats of cyclones and sea storms. So as midwives in this community, our role is providing community-based care. We have a reduced carbon footprint. We have a climate-friendly and climate-friendly health center. We use alternative energy and solar power. But apart from providing necessary maternal and newborn health services, we also work with the community on conservation, psychosocial services. We do telehealth referrals. We do emergency preparedness work with them, and we work with them on sustainable feeding practices. Next slide, please. So based on these experiences and those of other midwives associations that ICM works with, I want to discuss where this intersection lies. So we're seeing the evidence of the impact on maternal and newborn health of climate change globally. And with it, we have midwives who are able to and willing to provide a full range of services through community-based care and as a low-resource, environmentally sustainable solution. But when we see climate disasters, we also see midwives carry out their role as first responders, and they really minimize the loss of continuity of care and displacement. Next. So challenges that midwives and midwives associations face are similar in many of the climate crises that climate affected communities and climate crises we've been working with, and what we've heard from our associations. So, lack of resources is something, and financing comes up. That's a big challenge. Often there is in many countries a lack of clarity of the role of the midwife and the challenges that midwives experience with autonomous provision of care, the technical capacity issues in emergency response, and a general sense of a lack of support. We also see that there isn't a lot of involvement of women and midwives in preparedness and response planning. Midwives, if they're are able to advocate for the specific needs that pregnant women and newborns have, if they're involved in decision making. So if they are, they can work to ensure that the healthcare needs of pregnant women and infants are considered when disaster response plans and resources are set in these situations. Next, please. So, and as ICM increases its focus on climate, we see a continued need to advocate for the investment in sustainable midwifery models of care. Midwives, as they function, are just a very sustainable model. And ICM has also been connecting associations to resources and support for climate preparedness and planning. And we will continue to provide capacity building and facilitation for midwives associations that experience climate disasters. There's also a continued need to highlight the role of midwives in responding to climate change and climate disasters, and to ensure equity in knowledge sharing. So there's a lot of new things that we learn. There's a lot of research that comes up, and we need to work with midwifery associations and to make sure that they're learning from each other and are updated with latest developments and evidence. And at the center of ICM's work is our continued role in working with associations and stakeholders to ensure that midwives have an enabling environment and they can practice autonomously across ICM's scope of practice. And lastly, ICM is also playing the role of mobilizing midwives as activists and calling for change. As we go into COP, ICM has drafted an open letter urging for decisive measures to reduce carbon emissions. So, the letter also emphasized the critical role of midwives in addressing the health impacts of climate change on pregnancy, birth, and childhood. This letter has been signed by more than 59 of our member associations already. So we're also supporting midwives and midwives associations in using their collective power. So in summary, these are some of the ways that climate, midwives, and maternal health come together, and the way that they come together in our work. So thank you, and back to you, Aigul.
Thank you very much, Neha, and to all the panelists and speakers at today's webinar for sharing your insights, your reflections, and really showing us the impact that the midwives provide. To close off the webinar, I will provide this information in the chat as well. If anybody has any questions that were not answered or you didn't have time to provide it in the Q&A box, please feel free to email us. And now, without further ado, I would like to pass the floor to Mandira Paul, who is a senior program specialist for sexual and reproductive health and rights from Swedish International Development Cooperation Agency. We would also like to note that SIDA recognized the potential and powered midwives and was the first bilateral development agency to provide core funding to ICM. Over to you, Mandira, for closing remarks.
Thank you so much. And I'm sitting here with jackets because it's freezing cold where I am at the moment. So apologies for that. But this webinar has definitely brought up the temperature, because I think it's really, really inspiring to hear all of the stories and the experiences and the work that you're doing. And I am the lucky one at SIDA that gets to manage the partnership with ICM. And just to say, well, you already said that we were the first core funder of ICM, and that sort of is a proof of our commitment to midwifery and of our trust in your hard work. And just to share a little bit about our support, we've supported ICM for the past 3 years, partner with ICM and contributed towards their important work with fully flexible core funding, and with a focus to strengthen the governance and operations of the Secretariat in order to equip ICM to better support member associations across the globe. And the partnership has really been rewarding through following the inspiring progress and hard work of the organization. And just to say, I mean, I think the webinar has really showcased many reasons for doing this, but just to share a little bit about SIDA's thinking in our investments in ICM and in midwifery. Well, obviously, midwifery associations play a crucial role in raising the status of the midwifery profession, as we've heard today, demanding decent work environments and setting standards for midwifery education and certification processes. And this is, of course, crucial also in the quest for gender equality. Strong and functioning midwifery associations offer a sense of belonging and support in a quite hostile world that we're living in particular for SRHR frontline defenders. Ensuring sort of safe and decent and equal work for women health workers and women's equal representation in health leadership, midwives in particular, is key priority for SIDA and an essential component of building resilient and strong health systems and for achieving universal health coverage. So the partnership with ICM is quite obvious to us, and we're very grateful for being able to work together with you. And thank you so much for sharing some of the experiences today, and hopefully it has inspired others that are listening. And so back to you.
Thank you so much, Mandira. I would like to thank all the speakers and all the participants for taking part in this webinar. I hope going forward, ICM does more webinars of this sort. And I would like to wish everyone a great afternoon. And our webinar will be available online on ICM's YouTube. Good afternoon, everyone.